go to cloud. So that's just a cloud. Now
Yeah.
I'm gonna go and I'm gonna go into live, and I'm gonna click the live, go live, and then okay, 3, 2, 1. Hi guys, so today we have Abhilash. Welcome Abhilash. I'm so happy you are here today. Abhilash is naturopath, and in India he used to practice medicine, working as a nurse. He's also a research, and now Abhilash, you are based in UK, right?
Yeah.
Very welcome. How are you today?
Yeah, I'm very well. Thank you so much. And thank you all who are watching the live. All are welcome.
Yeah, would you like to talk a little bit what you do now in UK? I know you already told me a beautiful story about uh, the naturopathic work that you do, but would you like to tell a little bit more who you are, what you do?
Yeah. So my name is Abhilash Vijayan, and I'm from India. So I was a nurse in India. Then I started working with pharma industry and clinical research. While I was working with clinical research, I got into multiple health issues like hypertension, thyroid problems, arthritis, and I become pre-diabetic.
Mm,
And as I was working with the medical industry, I know all the top doctors. I went to all of them to help me. And during that time, I was based at Bangalore, Karnataka, and I met all the top, even the nephrologists, rheumatologists, and all the physicians. Finally, yeah, I become bankrupt in India. There are limits. Okay, even though I work with the medical industry and I got the medical insurance, but nothing could help.
mm,
Then, as I was not able to type on my laptop or computer, and I forced to resign from my job. And after that, I was bedridden for almost 6 months.
oh, geez, 6 months.
So when I went on bed, and I don't know what to do, and even no money. So then I decided, okay, let me try my best to come back to normal life, or I don't want to fail. I want to try my best. Then, uh, as I got the phone in my hand and internet, I went to all the research papers and I studied related to my condition, each and everything, whichever I tried naturopathy, homeopathy, Ayurveda, Siddha, Unani, Chinese medicine, whichever thing I could learn from the internet, I tried my best. Then I started treating myself, and as I even work with distribution ship, and I got the friends. Somehow I could get the medicines, and I started injecting myself, and I did all the experiments. So finally, I learned how the things work, how the medicine work, what we need to do to come back to normal life. One by one, I learned. Then during that time, even in my family, doctors were there, nurses were there, pharmacists were there, and they all demotivated me. But I know this is the end of life. If I do nothing, I'm dead.
Mm,
I'm not able to walk. If I need to go for toilet, somebody need to help me. Somebody need to carry. And even my family, they are in trouble, and I don't know what to do. But there is no other option. As a last option, I tried all these experiments. Then at some point, I got the idea, and slowly, I could regain my strength. I was able to walk. Then during that 6 months, I could come back to not a normal life, but I was able to walk. I can do my daily activities, and still I continued studying. Then I slowly stopped all the medications. So medication for thyroid, medication for hypertension, arthritis. First, I stopped at the arthritis medications. Then medication for diabetes, all those things. I stopped. At last, only I touched thyroid and medication for hypertension.
Mm.
Then during that time, everybody in the family, they discouraged me at all. Even I know if we stop the hypertensive medicine, suddenly there is an rebounding effect. But still, I, I as I was in the medical industry, I know how to stop it. So I stopped it. Then at last, I stopped thyroid medicines also. Then gradually, then later, I become or I could lead a normal life. Then I started helping or giving suggestions or ideas to my only close friends and families. Then during that time, I think maybe 1.5, 2 years is over. That time suddenly the COVID started. When the COVID started, the people were not getting beds in the hospital. They are not getting medications, and no scarcity of oxygen cylinder, and all were struggling though. So the people they will try their best to contact everyone, because as I was in the medical industry and I used to train people in when I was working with the pharma industry, I used to train even the doctors, the nurses, then patients and their families regarding the therapies.
Mm.
So whomever had my contact, they called me, even my family members. So I somehow, when I treat or when I help my family to come out of COVID, I learned what to do with that. Then I started giving suggestions what to do to come out of breathlessness and the COVID symptoms. So exactly, I don't remember. I never expected, and I never maintained any record of how many I helped. Maybe around 400 to 500 people I could help.
Mm.
So after COVID, what happened was the people whom I helped, they started bringing to me different cases. Whomever the people who struggle with the end of life, or like the cancer, kidney problems, and other issues like that,
Mm.
thyroid, hypertension, PCOD, fibroid, type 2 diabetes, and many other diseases. As they were not getting cure, or they were into trouble, and with no medicine works, nothing can be done. In that stage, people try to bring uh, those patients to me. Then I got scared. Without proper license or proper qualification, how I can treat. In India, there's a system called Ayush healthcare. Under that, all this naturopathy, homeopathy, all those comes under that.
Mm.
And I joined for a course. I did that course, and I got a certification for naturopathy. So after that, I became a naturotherapist, and based on that, I started helping people. During that time, I was based at Bangalore, Karnataka, and I was going to a clinic there, and I practiced in that clinic for almost 6 to 8 months. So then my family got scared. So they're scared, because if I am doing like this, they know I will be in trouble one day. So they sent me to UK. So they expected that I never will continue this treatment. So after coming to UK, because see, when we help people and when they are coming out of disease, and when they come to a new life or what they never expected, their happiness and they praise us, and that gives me an immense pleasure. So I never enjoyed such an experience before in my life. So uh, usually when I work for anything or when I learn, after some time I feel boring to do the thing repeatedly. So, but here, what happened was, as long as I help people and they recover or they come to normal life, that gives an immense pleasure. So I don't know, I cannot explain what it
Oh,
is or how it is, but it's
I
amazing
understand.
feeling. No, I think nobody can explain that feeling. So, so that gave me an inspiration, and I tried continue doing that. So then, even for 2 months, I were in UK, but still, I'm not finding that happiness which I enjoyed when I were in Bangalore. So then I started uh, a naturopathy course at the UK in London, CNM College. I joined the course, and after joining, I joined in the Association of Naturopathic Practitioners group. I got the membership as a student practitioner. Then I took the professional indemnity insurance at UK, and I started helping people. But initially, people were not trusting me at UK. But still, when I travel or when people talk, I used to tell my story,
Mm,
and slowly people uh, listening, and but still they will not follow 100% what we say, because they will check with their GP, and
yeah.
there are some concerns.
Mm,
But the people who followed, they could come out of it.
mm,
Then here also slowly, maybe the client base or people started getting healed. So now I continue my journey like this. So maybe I don't know how many contact from the different parts of the world, from India especially, yes, uh, from all the states. From India, people contact me, from US, Canada, then Gulf countries, from Singapore, and all other Australia, from different countries. People contact me. I just give them suggestions, or I just share my knowledge. I give them guidance, and whoever follow me, they are able to come back to their normal life. Maybe around 60 to 70%, they can come out of their problems. Other 30 to 40%, they will listen to their family members, and other doctors and nurses and pharmacists will be there in the family, and they will discourage, because what they learn, they will think against that. If you practice all these things, they will be in trouble. So they will brainwash those people, and the few will be discontinuing it. We cannot help them,
mm,
because nobody will believe. The people cannot understand there is a life. There are ways to come out of diseases,
mm,
but we are not treating anyone. We are not trying to heal anyone. But what we learned, we are just sharing the knowledge.
mm,
When we practice certain things, that helps uh, to lead a better life. That's
mm,
what happening here.
mm,
So if you are who are listening, if you are willing to practice certain things, yeah, you have naturopath, you have homeopath, and alternative medicine. You can
yeah.
try your best, and lead a better life. That's what my suggestion. And for all the problems, even sexual problems or any other issues, there are solutions, but you need to meet the right person or right people's guidance you should get. Then you will be blessed.
Yeah, it is
Yeah, that,
powerful. Natural medicine, it's so powerful because it works with your body. It's just, thank you so much for sharing that. And
yeah.
Abhilash, where can people find you if they want to contact you? How can they contact you?
Uh,
Oh, if you, or we can share that maybe a link or something, or email, or directly on the Facebook.
Yeah, I'm on Facebook, I'm on Instagram, and on WhatsApp.
Yeah. And are you open to share then your details in the comments after we finish?
Yeah, we'll do that. Even I don't mind sharing my WhatsApp number. But I suggest people not to call me on directly. Who all want to contact me, they can just send a WhatsApp text or a voice message.
Yeah,
When I am free, I will get back to them.
exactly. Yeah. Thank you so much for that. And is there anything else that you would like to add? Sorry, I just interrupted you.
Yeah, that's it. That's about my life story. And I never expected that I'll be in such a meeting and I'll be sharing all these details with anyone, because once I thought, maybe I think 7 or 10 years back, I thought I
Mm,
was dead. This is my new life. So
mm.
I thought I will help as many as I can.
Such a beautiful mission. Wow.
Yeah.
Yeah. Oh my gosh, this is so inspiring as well. You healed yourself. You are healing so many patients, clients that come to you, and it's all naturally with a natural medicine. How cool is that, guys? This is wow. This is cool. And can I ask you just one question? When
Yeah,
you
please.
when you hear next level or next level transformation, what is the first thought that comes to your mind?
So when I were in problem, if I come to know about such group or such people or such knowledge sharing institution or group, and I could have used that and I could have come out easily. So many people should know about such groups and community, and they should transform their life.
Yeah. Ah,
Because
absolutely.
I learned from my mistakes and self learning. It took a lot of time. When
Yeah.
people like you are there to help others, so easily people can come out of their problem. So I took almost 6 months to come out of my problem. But the people know about this community and they are part. They who become part of this, they can easily come out. Maybe 3 months is enough, or up to 6 months. Okay, that's fine.
Yeah, depends what's going
Yeah.
on. Exactly. Yeah.
Yeah. Just like God's gift, or what to say.
Yeah.
Yeah, your work is much appreciated.
Oh, thank you so much. That is so beautiful. So thank you so much, Abhilash. That was beautiful story and very inspiring as well, and giving us all hope that maybe, natural medicine, it is the way for the
Yeah.
future. And we all have choices, I know some people maybe choose different route, but we have choice to actually heal, let our bodies to heal naturally. That's the message, isn't it?
Yes, absolutely right.
Yeah, yeah. I just want to thank you for coming here. And guys, if you have any questions, and please do contact Abhilash directly, and he's gonna be sharing contact details in the comments. So check them out after we finish live. And yeah, hope you enjoy it. And thank you so much.
Yeah, thank you.
Thank you.
Yeah, wish you all good luck. Take care.
Bye.
Bye.